I would once again encourage the entire audience to warm up and send some questions in to the panel via their electronic devices, via the phone, through the AAO mobile app. Meanwhile, we have time for one question, and I'm going to ask that, and that is to the panel, the presenters. In the limited clinical time that we have with each patient, are there parameters that you particularly focus on for keeping in mind the usefulness of that parameter for progression? Joe?
I guess I would focus primarily on the retinal nerve fiber layer, and especially looking in terms of progression at the progression analysis, both for the volumetric scan, which will show me whether or not there's been progression in a place and shape that I would expect in glaucoma, and also in the mean nerve fiber layer thickness, superior inferior quadrant. And then if I have a corresponding increase in the cup to disc ratio, that gives me a high degree of confidence that progression is really occurring.
Julia?
So the aspect that I pay attention to the most with regards to progression is in the spectralis. You get a progression analysis showing the sequential line graphs really outlining the contour. And there you can see small areas of change focally that you can't pick up on the averages. So that's what I use predominantly. It's really helpful for patients, and when they see that red, that's a change.
And Claude, if I could get your opinion?
I focus on MRW and nerve fiber layer thickness, but when Heidelberg has more robust integration of the macular and their own continuous thickness map, like is currently on the Cirrus, that will be very important to me.
Yeah. It will be nice to see all these parameters on one page as a report. As Claude showed, what might be coming is everything displayed on one page so that you can see a comprehensive report, and you can see if all the parameters are matching, because they should. The RNFL loss should correspond to the macular thickness loss and should correspond to the BMO MRW.